altered states of consciousness refer to shifts in our awareness, perception, and cognition that deviate from our normal waking state. These states can emerge naturally during activities that fully engage our minds and bodies, commonly known as flow states, or be induced by external agents such as psychedelics. Both types of experiences offer unique insights into how our brains function and how we can harness these states for creativity, learning, and personal growth. Flow states, a term popularized by psychologist Mihaly Csikszentmihalyi, describe those moments when individuals become so immersed in an activity that time seems to distort and self-consciousness fades away. Think of an artist completely absorbed in painting, a musician lost in performance, or even a student fully engaged in solving a challenging problem. In these moments, the boundaries between action and awareness blur, creating a sense of effortless focus and intrinsic satisfaction. You ever experienced a time when you were so engrossed in an activity that hours felt like minutes? On the other hand, psychedelic experiences induced by substances, such as psilocybin or LSD, alter consciousness in ways that can be both profound and challenging. These experiences often lead to vivid visual and emotional phenomena, a breakdown of the usual sense of self, and sometimes even mystical or spiritual insights. Research in recent years has started to uncover the potential therapeutic benefits of controlled psychedelic experiences, suggesting they might help treat conditions like depression, PTSD, and anxiety. But what distinguishes a psychedelic state from the natural flow state? While both can foster creativity and insight, psychedelics disrupt normal neural networks in a more unpredictable manner, often leading to a radical shift in perspective. Neuroscientists are beginning to explore how these altered states affect brain activity. For instance, during flow states, the prefrontal cortex, the area responsible for planning and self-monitoring, often shows reduced activity, which might explain the feeling of losing oneself in the moment. In contrast, psychedelic experiences are marked by a temporary increase in connectivity between brain regions that typically don't interact, which can lead to novel perceptions and thought patterns. How do you think these changes in brain connectivity might influence the way we solve problems or experience emotions? Both flow and psychedelic states challenge our conventional understanding of consciousness. They reveal that the brain is capable of a wide range of experiences beyond our everyday awareness. While flow states are usually accessible through practice and engaging activities, psychedelic experiences often require a controlled environment and guidance due to their intensity. Despite their differences, both types of altered states offer opportunities for personal exploration and creative breakthroughs, prompting us to ask, what could we learn about ourselves if we could safely access these deeper layers of consciousness? In summary, exploring altered states of consciousness from the naturally occurring flow state to the more profound psychedelic experience opens up exciting possibilities for enhancing creativity, understanding our minds, and even addressing mental health challenges. These states remind us that our perception of reality is far more flexible than we might think, inviting us to explore new ways of thinking and being. What aspects of your consciousness might you be curious to explore, and how do you think these altered states could enrich your understanding of yourself and the world around you? Altered states of consciousness refer to mental conditions that differ significantly from ordinary waking awareness. These states can be induced naturally through activities like deep concentration or flow, or via external means such as meditation and psychedelic substances. Researchers study these states to understand the brain's flexibility, creativity, and potential therapeutic benefits. Scientific investigations use neuroimaging and psychological assessments to map these different states and their effects on perception and cognition. A student might experience an altered state during a challenging sports practice when time seems to slow down and actions feel fluid. It's like switching from standard definition to high definition. Your perception becomes clearer, richer, and more intense. Flow states occur when a person is fully immersed in an activity, experiencing deep focus, enjoyment, and a sense of control. In this state, the brain shows a unique pattern of reduced self-referential thought and heightened concentration, often marked by an optimal balance of challenge and skill. Neurotransmitters such as dopamine and endorphins are released, enhancing mood and performance. Flow has been linked to improved productivity, creativity, and overall well-being. An artist lost in their work, where hours pass by without noticing time, is experiencing a flow state. It's like being completely in tune with your instrument while playing music. Every note feels natural and you are fully absorbed in the performance. Psychedelic experiences involve the temporary alteration of perception, mood, and cognitive processes through substances that affect neurotransmitter systems, particularly serotonin. Brain imaging studies show that psychedelics can disrupt the default mode network, which is associated with self-referential thoughts and ego. This disruption may lead to profound experiences of interconnectedness and altered reality. Such research helps us understand the neural basis of consciousness and its potential for therapeutic use. In clinical studies, participants administered a controlled dose of a psychedelic substance report vivid sensory changes and altered self-perception that correlate with measurable changes in brain activity. It's like opening a new channel on your TV. Suddenly, you see different programs and colors that you've never experienced before, shifting your normal viewing experience. Scientists measure flow states using psychological surveys, behavioral observations, and neuroimaging techniques like EEG and fMRI. These methods reveal that during flow, there is increased synchronization of brain activity and a reduction in mind wandering. The state is characterized by a loss of self-consciousness and a seamless merging of action and awareness. Understanding flow helps researchers explore how optimal performance can be achieved. In sports, arts, and academic, athletes are often monitored with brain sensors during high-intensity training to identify patterns that predict when they enter a flow state, leading to better performance strategies. It's like tuning an instrument. By adjusting and fine-tuning, you reach a state where every note harmonizes perfectly, creating a flawless melody. Set refers to the individual's mindset and expectations, while setting is the physical and social environment in which a psychedelic experience occurs. Both factors critically influence the outcome of the experience, determining whether it will be therapeutic or overwhelming. Researchers have found that a supportive, controlled environment enhances positive outcomes and minimizes risks. This concept underscores the importance of context when exploring psychedelic-induced altered states. In a clinical trial, participants given psychedelics in a calm, safe, and supportive room report more beneficial experiences compared to those in less controlled environments. It's like the difference between reading a book in a quiet library versus a noisy cafe. The environment significantly shapes your experience and comprehension. Flow states have been linked to heightened creativity and peak performance across various fields, from sports to art and academic work. When in flow, individuals exhibit increased problem-solving abilities and innovative thinking due to focused attention and reduced mental clutter. This state supports the development of novel ideas and efficient execution of complex tasks. Understanding flow provides practical strategies to enhance productivity and creative output in everyday life. A writer might find that during a deep flow state, ideas come rapidly and coherently, leading to the creation of an inspiring piece of literature. It's like having all the pieces of a puzzle fall into place effortlessly. The overall picture becomes clear and complete without forced effort. Recent research has explored the therapeutic potential of psychedelics for treating mental health conditions such as depression, PTSD, and anxiety. Controlled studies indicate that these substances, when used in guided sessions, can lead to lasting positive changes by altering brain connectivity and reducing rigid thought patterns. Psychedelic therapy often involves preparatory sessions, the guided experience itself, and integration afterward to maximize benefits. Although promising, these approaches are subject to strict regulations and ongoing scientific validation. Clinical trials have shown that patients with treatment-resistant depression experience significant improvements after a few guided psychedelic therapy sessions. It's like rebooting a computer system, resetting the network connections to clear out persistent glitches and restore smooth functioning. Techniques to harness altered states, such as meditation, mindfulness, and controlled daydreaming, can enhance everyday learning by increasing focus and reducing stress. These practices help shift the brain into states that favor creativity, memory consolidation, and innovative problem-solving. Research shows that regular practice can lead to measurable changes in brain activity that support both academic performance and well-being. Integrating these techniques into daily routines can serve as a powerful tool for lifelong learning and personal growth. A student who practices mindfulness meditation before studying may find that they can concentrate better and recall information more efficiently during exams. It's like setting your phone to do not disturb mode. You reduce interruptions and create an environment where you can fully engage with your tasks. Exploring altered states of consciousness, whether through inducing flow or using psychedelics, raises important ethical and practical questions regarding safety, consent, and long-term effects. Researchers emphasize the need for controlled settings, professional guidance, and clear guidelines to protect participants. While these states offer valuable insights into human cognition and potential therapeutic applications, they must be approached with caution. Ongoing studies and regulatory oversight aim to balance innovation with ethical responsibility. Institutional review boards carefully evaluate studies on psychedelic therapy to ensure that participants are fully informed and that risks are minimized. It's like exploring a new hiking trail. You need proper equipment, clear guidelines, and a knowledgeable guide to ensure the journey is safe and rewarding.